you're going through breast cancer therapy and you're having really bad joint pain. I'm Zeinab, I'm the pharmacist from PillSorted. What is this? Is this a side effect? Or is this something you need to be worried about? Can I do something instead? This is one of the great questions that I got from the breast cancer support group. I meet up with lovely people in these great support groups, and what I do is I start with some practical tips. This time I was talking about the heat with the medication, also the most common side effects that are expected after a breast cancer treatment, and then we open up to question and answers so that the most important questions make it to these videos. This breast cancer support group was part of the Cambridge Cancer Help Center. The lovely ladies that I had the pleasure to talk to are going through the journey of breast cancer treatment at different stages, different events from chemo to surgery and all of that. If I wanted to categorize the most common side effects, there's 6 really important side effects that happen when we're going through treatment for breast cancer. So the main underlying logic is that we want to cut down the amount of estrogen so that we don't let the cancer cells thrive. Estrogen does a lot of important things in our bodies, okay? So a lot of those side effects are consequences of this effect. So hot flushes and sweats are quite common when we're going through treatment. Medications like the tamoxifen, letrozole, anastrozole, exemestane, these are a couple of regular medications that are used for it, and you might be on them for years, 5 years, 10 years. They either completely block the estrogen or moderately block the estrogen, and that can cause the hot flushes and the sweat. It's really important to try to keep yourself cool, especially nighttime. If you wake up from sleep all drenched in sweat and it's really uncomfortable, try to make your bedtime routine in a way that is cooler, especially in this heat wave. I was even saying, if you find that downstairs is cooler than upstairs, just move downstairs for this while, because having interrupted sleep for quite a couple of nights can affect how your body responds to the treatment and how fast it can recover. So avoid things like too much alcohol at the end of the day or too much caffeine at the end of the day, because they can make these symptoms worse. The other important effect is the bone thinning effect of these medications. That's why it's really, really important to make sure that you are offered vitamin D and calcium, that are the other important parts of your bone health, but also scans to check your bone density. This is really important to ask for it as a routine to see how your bone health is. Now, the third one is the joint aches and stiffness. I'm going to talk a little bit more about that in one of the question and answers because it's an important one. It is quite common with the medications. It's usually much worse first thing in the morning. Is much worse on your knees and your fingers, but we'll explain more about this later in the video. The other one is muscle loss and weight change. Okay, so the treatments do affect your weight and they do affect your muscles, so it's really important to think about exercise as that magic medicine. It really helps support your muscles, and it's incredible for the next side effect, which is tiredness. There's a lot of evidence that shows the cancer fatigue, the response is not total rest, it's actually light movement. So movement does help relieve that tiredness much more than if you put yourself to bed rest. Last one is skin dryness, and it's really important to think about all of your body, especially vaginal dryness, okay, because that's something that surprises. The reason being is estrogen is really important, and when there's lower estrogen, your whole skin dries up, okay? You need to deal with vaginal dryness as you deal with baby's nappy rash, I tell you. So as moms, we would use a mild nappy rash cream a couple of times per week, more as precaution and prevention than trying to deal with an actual nappy rash. Do the same for the vaginal dryness. There's a lot of very good moisturizers, and there are lots of different bases for them, silicone bases, aqua bases. There's lots of different formulations. Ask your doctor and prescribers for them. We're really good at it as well to help you find that right one, but it's good to use them continuously and more as a prevention regularly than when it it gets dry, it becomes irritated, it's harder to deal with and treat. Now, let's go on to the questions. So one of the really good questions that came up was, what can I take to help me feel better? Which supplements would you recommend? Okay, let's go back into what we're trying to do with the treatment, with the breast cancer treatment. The important thing is we want to starve those cancer cells from those hormones, okay, so estrogen and all of that. So if there are supplements that are, for example, isoflavones, the plant-based phytoestrogens, they are claims that they can mimic the estrogen, okay, which is exactly the ones that we need to avoid at these stages, okay? So things like black cohosh, things like very high strength concentrated soya bases. Soya in food, perfectly fine, definitely take it. But those high concentrated phytoestrogens, which should be a no-go. The other one is the St. John's wort. It's used to help calm down the nerves and all of that, but it does interact with the drug processing enzymes in our body. So again, another one that you should not take. The important ones are the vitamin D and calcium. Taking a multivitamin and mineral within the recommended daily allowance, perfectly fine. It will help those days that you're not up for it to get that baseline of nutrition. So that was the first question about the supplement. But if you're not sure about any specific supplement, okay, so if it's collagen, if it's turmeric, or bring it or ask us, as pharmacists know a lot about the medications and supplements and if they interact or if they're actually worth it or not, okay, so reach out to us. The second question was about joint pain, so that's why I'm going to explain more. So a lady was on letrozole, was having really bad joint pain at the point that she was wanting to have an alternative, and also that how about I take really long, high performance like marathon walks and that sort of thing. In a way, these two questions are related, but I will separate them and answer as well. So the first important thing is the letrozole is a aromatase inhibitor, and that means it lowers the estrogen. That's how it protects you, how it works. But not having enough estrogen does affect our joints, make it much stiffer. The best evidence that there is out there is that to get your joints to be less stiff, you need to move them. So the more you use it, the more you have movement, the less stiff you're gonna feel. That is really important. I'd suggest keep on moving as the first step for relieving that joint pain. Now, for walking as a high speed or marathon wise, really long length, you can, but just you need to build onto it gradually. So it's really important to give time to heal and recover between trainings and just build up that resilience, okay? So there's nothing against it, but again, it does depend on your certain circumstances. If you're feeling 100%, if you can do it, sometimes it becomes a little bit too daunting, especially when you have to do regular tests and check your immune levels and all of that, okay? But if you can, there's nothing against it. It's just that build it gradually. For what's the best option, there's so many different things that we need to decide when you put on a treatment. So between the different aromatase inhibitors, between the different treatments, so the best person to discuss about this is your consultants and the cancer team. But make sure that you can express your biggest concern. So be clear on what do you mean when you say I've got joint pain. Is it that it's really stiff first thing in the morning? Is it worse at nighttime? So what is expected is to be stiffer in the morning, that with gradual movement it becomes easier to be flexible throughout the day. But if it's not that, or if you feel that the pain is one specific area, that might be something totally different. My point is, talk about your symptoms clearly to your consultant and see, and then they can establish, is there a better alternative? There are definitely different alternatives to do. There are different medications that can help as well. So one important thing is paracetamol is one of the most established pain relief, is quite safe. If you're planning to do some movement and it's going to leave you really tired, it's not a bad idea to take it. So if, for example, you're practicing for a longer walk, take that paracetamol before you go out, okay? That will help you keep active for longer. There are lots of other medications that can help relieve, specific joint pains or be used both locally therapy and as a add-on to help you get through the treatment. But what I don't want you to do is become so difficult that you just drop the taking the medication and don't tell anyone, because that will affect the cancer. The third question was an interesting one. So when we were talking about the dryness effect, the different tests came up. So us go through lots of different tests when we're going through treatment. So if it is a smear test, all of these, they can feel very, very uncomfortable, especially if there's already like the vaginal dryness, the smear test and all. What I was really disappointed was that none of the ladies had ever been offered any pain relief before or during this treatment, even for their coil removal. But it is definitely within your rights to ask for it. There's lots of different options. You can ask for local anesthetic, you can ask for numbing cream, you can ask for something to relax your muscles even beforehand. So please ask for something that'll help this process become easier on you. There are lots of different options, okay? And then what do you need to look out for? You're going through a lot. This is a big trauma, okay? So rest is one of the important parts that gets affected by our female hormones, but it is linked and related to so many other functions and organs in our body. So if you feel generally unwell, that you feel breathless, you feel you can't do any of the normal things that you push yourself through to do on a daily basis, definitely worth checking, okay? It's better to get checked more and then do more blood tests than not, because your immunity might be suppressed. You might get more susceptible to pick up different infections. So be careful, especially if you feel there's breathlessness, if you feel really unwell or faint. If there's any questions that you have about your medications, subscribe to our channels. We can review your medication, especially if there's groups that you are comfortable with discussing and going through the same condition and the same treatment journeys. It's really good to get most of the common questions out there and support other people that are going through the same. Reach out to us for any questions. We're here for that clinician-led health advice. Thank you.